Welcome to the deep dive. Today we're diving into a pretty complex area of genetics, chromosome 8p syndromes. We've got some really interesting research from the University of Colorado School of Medicine, and
It's cutting edge stuff. This isn't just your basic genetics 101.
definitely not. So chromosome 8p syndromes, I have to admit, it's not a term you hear every day.
It's a mouthful, right? Basically, we're talking about specific rearrangements on chromosome 8. On the short arm, the P arm.
Okay, so the P arm, what kind of rearrangements are we talking about?
Well, think of it like shuffling a deck of cards. Sometimes cards get duplicated, deleted, or even flipped around. These changes can lead to a whole bunch of challenges for individuals.
That's a great analogy. So not your typical genetic inheritance patterns then.
Right. These rearrangements are usually de novo, meaning they happen spontaneously. And the researchers in this study actually followed 24 patients in a dedicated clinic.
Wow, 24 patients. That's quite a sample size for something this rare.
It is, and it gives us some really valuable insights into the real-world presentation of these syndromes.
So let's talk about those shuffles you mentioned. What are the main types of chromosome 8p rearrangements they're seeing?
The most common one is called 8p inverted duplication with deletion, or 8p invertible for short.
8p invertible. Okay, I'm trying to picture that.
Imagine a section of the P arm being flipped, then duplicated, and then a little piece gets deleted.
Wow, genetics is so complex.
It is. And then there are simpler rearrangements too, like 8p deletions where a portion of the arm is just missing, and 8p duplications where there's an extra portion.
So we have flipped and duplicated, missing piece, and extra piece.
Mhm.
What other kinds of rearrangements did they find?
There were a couple of rarer ones, too. 8p8q unbalanced translocation, where parts of the short arm swap places with parts of the long arm 8q. And then there's 8p mosaic ring, where part of 8p forms a ring shape, and it coexists with normal chromosomes.
It's incredible how much variation can exist within a single chromosome.
Yeah.
And you mentioned that this study followed real patients. What were some of the things that stood out to you about these cases?
One thing that really struck me was that 13% of the patients actually had another genetic condition on top of their 8p syndrome.
Wow, so it's not always a simple diagnosis.
Exactly. And that brings up another important point. Genetic testing technology is always evolving. There was even one case in the study where an 8p duplication was initially diagnosed, but with newer technology, it was reclassified as 8p invertible.
That's a good reminder that diagnoses can change as technology improves. So it's important to stay updated on the latest advancements.
Absolutely. Now let's switch gears a bit and talk about what these genetic variations actually mean for individuals in their day-to-day lives.
Yeah, let's get into the real-life impact of these syndromes.
Well, it's important to remember that it's a spectrum. Even people with the same 8p rearrangement can have very different experiences.
Right. So what kind of challenges do the researchers observe in these patients?
Neurological features were definitely prominent. 25% of the patients had a history of seizures, and brain MRIs showed abnormalities in 80% of the patients.
So brain development is definitely affected. What kinds of abnormalities were they seeing?
The most common finding, especially in those with 8p invertible, was hypoplasia or aplasia of the corpus callosum.
For those of us who haven't brushed up on our brain anatomy lately, what exactly is the corpus callosum?
It's essentially the communication highway between the two hemispheres of the brain. It's a thick band of nerve fibers that connects them.
So if it's underdeveloped or absent, that communication is disrupted.
Exactly.
Makes sense. What other neurological impacts did they see?
One interesting finding was the high prevalence of cortical visual impairment, or CVI. It was diagnosed in 29% of the patients, which is higher than what's been previously reported.
CVI. I'm not familiar with that one. What does that mean exactly?
Basically, it means that the brain has trouble processing visual information even if the eyes themselves are healthy. It can affect how a person sees and interacts with the world around them.
Wow, that's a significant finding. So we've got seizures, brain abnormalities, and CDI. What about other areas of health? Did the research look beyond just the brain?
Oh, absolutely. They found that 55% of the patients had abnormal echocardiogram findings indicating some potential heart issues.
So heart health is another area that needs close attention.
Definitely. While most of the patients didn't need surgeries, some did require interventions like pacemakers or procedures to close holes in their hearts.
Okay, so neurological and cardiovascular issues. Did the research also touch on how these genetic variations affect daily life?
They did. They looked at things like self-care toileting, feeding, mobility, sensory processing, and communication, all those essential skills we need for everyday living.
I imagine those can be quite challenging for individuals with 8p syndromes.
Yeah, most of the children needed help with things like dressing hygiene and toileting.
What about eating? Could most of the kids eat by mouth?
Most of them could, but a lot of them still needed some assistance from caregivers, whether for safety reasons or to adjust their food.
And what about getting around? Did most of the children in the study walk independently?
The majority could, but often not until after they turned two. A lot of them used adaptive equipment like walkers or orthotic.
So physical therapy is probably a key part of their care.
Definitely. And stretching was also often recommended to address things like tiptoe walking.
Right. We touched on sensory processing earlier.
Yes, a lot of the children struggled with processing sensory input, which led to all sorts of challenges: self-regulation, feeding hygiene, even just being aware of their bodies during activities.
Wow. Sounds like navigating daily life can be really tough. Did the research address communication skills at all?
It did, and they found that all of the patients had some level of speech and language delay, with some being nonverbal.
That must be a big concern for a lot of families. What kinds of support are available to help these individuals communicate?
The researchers emphasized the importance of augmentative and alternative communication, or AAC. This can include things like using visual cues or even dedicated communication devices. Interestingly, though, all the individuals with 8p deletion were able to use verbal speech as their primary way of communicating.
So there's hope for those with 8p deletion. What about mental and behavioral health? That often gets overlooked.
You're absolutely right. It's a crucial area, and traditional screening tools may not be enough to capture the full picture. Parent reports were essential in this study for identifying things like problematic refusals, ADHD, OCD, anxiety, irritability, aggression, and even speech apraxia.
It's a lot to keep in mind. Did they find any differences in mental and behavioral profiles between the different genetic subtypes?
They did observe some differences, but more research is definitely needed in this area.
It sounds like we're only just scratching the surface of these syndromes. They're incredibly complex.
We are, and there's still so much to learn. But the good news is that there are ways to support individuals with chromosome 8p syndromes, and we'll be talking about those in the next part of our deep dive. Welcome back. We were just talking about some of the really big challenges that folks with chromosome 8p syndromes have to deal with. Now let's dive into the cognitive landscape a little bit.
Yeah, let's talk cognition. I imagine there's a wide range given all the variations we see in these syndromes.
You're absolutely on point. The research team found that there is a huge range in cognitive abilities, even among people with the same 8p rearrangement. Age doesn't really predict their developmental level very well, which means you've got to look at each person as an individual.
So it's not like saying, okay, you have this 8p rearrangement, so you're going to have this level of cognitive function.
Exactly. Like folks with 8p inviductal tend to have the lowest levels of development. The kids over 5 in this group, they all fit the criteria for intellectual disability.
That's a big deal. What about the other types? Do they have different cognitive profiles?
They do. Individuals with AP deletion, they actually have a wider range of skills. Some of them even showed average language skills, even if their overall intellectual development was lower.
That's fascinating. Even with a deletion, some skills are staying strong. What about those rarer subtypes, like 8p euplication or 8p8q unbalanced translocation and 8t mosaic ring?
Yeah, unfortunately, there wasn't enough data on those rarer ones because the sample sizes were too small. But each one did show a unique developmental profile. We definitely need more research to understand these better.
It sounds like there's still so much to learn about how these less common rearrangements affect cognition. But knowing all of this, what can families and professionals actually do to help? Are there any evidence-based guidelines for managing these syndromes?
There are. That's what makes this research so useful. It's not just about understanding what these syndromes are, it's about putting that knowledge into action.
So let's get strategic. What are the key things that families and professionals should be focusing on?
First things first, you've got to have a team approach. That means geneticists, neurologists, developmental pediatricians, therapists like occupational physical and speech language pathologists, psychologists, social workers, the whole nine yards.
It takes a village, as they say. And it makes sense with such complex syndromes. Having that coordinated team can really make a huge difference. What about early intervention? That seems like it would be crucial.
It is. Early intervention is key to helping these folks reach their full potential. And it's not a one-and-done kind of thing. Ongoing monitoring and support are essential throughout their lives.
So consistent check-ins and adjustments along the way. What are some of the specific areas that need to be monitored?
Growth is a big one. Monitoring for things like short stature and addressing any feeding or nutrition issues are crucial. Imaging is also really important. Brain MRIs are recommended depending on what symptoms they're having, and echocardiograms are recommended a diagnosis to rule out any heart problems.
So regular checkups with specialists and imaging as needed. Anything else on that checklist?
Scoliosis screening is also important because of the low muscle tone and potential gait issues we talked about earlier. Annual eye exams are key too because CVI and other vision problems are so common. And for boys, it's recommended to get a urologic evaluation to check for undescended testes and hypospadias.
Wow, that's a lot to keep track of. It really highlights how important proactive healthcare management is for these individuals.
Yeah.
What about ongoing support? What else should families and professionals be thinking about?
Mental and behavioral health screening and evaluation are essential. Remember, those traditional screening tools might not be enough. It's really important to work with professionals who get the unique challenges of chromosome 8p syndromes.
Finding the right people is so important. Did the researchers talk about the transition to adult care? That can be tricky for any individual with special needs, especially those with these complex genetic syndromes.
They did, and they recommend starting the planning process around age 12 to make sure that transition goes smoothly. That means finding adult medical providers, connecting with community resources, and thinking about legal and financial stuff like guardianship and benefits.
Starting early is such a good idea. It gives families and individuals time to prepare for what's coming. It's great to see such practical advice coming out of this research. What really stood out to you from this research? Anything that surprised you?
One thing that really struck me was how much they emphasized revisiting genetic testing if it's needed. Like if what they're seeing clinically doesn't match up with the original diagnosis, or if the testing was done a while ago with older technology, it might be worth getting another genetic evaluation.
That's a good point. Genetic testing is constantly getting better.
Uh,
Did the researchers mention any specific resources for families who are looking for more information and support?
They highlighted the Project 8p Foundation. It's a patient advocacy group that's doing some amazing work. They provide resources, connect families, and even help fund research.
Having an organization like that must be a lifeline for families. It's so important to feel like you're not alone and that you have people who understand what you're going through. Before we wrap up this section, is there anything else you want listeners to know about managing these syndromes?
I think the main takeaway is that while chromosome 8p syndromes do come with some unique challenges, early intervention, a team approach, and ongoing support can really make all the difference. It's about building resilience, helping them reach their full potential, and making sure they can live fulfilling lives.
Well said. It's not just about managing symptoms, it's about supporting the whole person. This deep dive has been so informative. We've talked about the ins and outs, the genetics, the real-life impact, and the best ways to support these individuals. But before we get too sappy, let's take a quick break and we'll be back with the final part of our deep dive. Welcome back to the deep dive. We've been exploring this world of chromosome 8p syndromes. It's been a fascinating journey.
It has. And we've covered so much ground, but I think it's really important to remember that genetics is just the starting point. It doesn't tell us everything.
Right. It's not the whole picture.
Definitely not.
Yeah.
The environment, the support systems, the therapies and interventions, they all play such a huge role in shaping the lives of people with 8p syndromes.
It's that nature versus nurture debate again. But here, it feels more like nature and nurture working together.
Exactly. It's all about how they interact. And that's why understanding these syndromes is so important, that knowledge can help us create environments that are more supportive, more inclusive, places where these individuals can really thrive.
It's about helping them reach their full potential, not just helping them get by. And research like this is paving the way for a better future. What are your final thoughts for our listeners today?
One thing that really stood out to me was just how much variability we see, even within the same 8p subtype. It reminds us that we can't make assumptions about people based on a diagnosis alone.
Everyone's different. Every case is unique.
Exactly. Each person has their own strengths and their own challenges, their own unique needs. That should always be our focus when we're thinking about how to support them.
I love that. It's about seeing the person, not just the syndrome. So what's the biggest takeaway from all of this?
I think the main takeaway is that chromosome 8p syndromes do present some really tough challenges. But early intervention, a multidisciplinary approach, and ongoing support can make a huge difference. We can help these individuals build resilience, we can help them maximize their potential, and ultimately, we can help them live fulfilling lives.
That's beautifully said. It's not just about managing symptoms, it's about supporting the whole person. This deep dive has been so informative. We've learned so much about how complex these syndromes are, how important personalized care is, and just how powerful hope and resilience can be. What advice do you have for our listeners who might be looking for more information or support?
If you're concerned about yourself or someone you love, the first step is always to talk to your doctor. They can point you in the right direction, connect you with specialists. And of course, the Project 8P Foundation is an incredible resource for families.
It's all about getting the right information, connecting with the right people, and knowing you're not alone.
Yeah.
Well, on that note of empowerment and hopefully a thirst for more knowledge, we're going to wrap up this deep dive into the world of chromosome 8p syndromes. I hope you've learned something new today, gained a new perspective, and most importantly, feel empowered to learn more and seek support if you need it.
Thanks for joining us.
And remember, every deep dive is a step towards a more informed and hopefully a more compassionate world. Keep those brains curious.